So thank you all for joining this tonight. I hope you take something away from it. But what I want to sort of like get across is try and make it more interactive, try to get you to think about where you are now, because you're all on unique journeys. Nobody has the same path. It's all individual. So use this space and this time to reflect on where you're at and what choices you need to make going forward. Okay. So we've got the fertility maze here. It's quite interesting. It is a maze, and many of you watching this tonight will be at different stages of your journey. So some of you will just be starting out. Others will have been on this journey for quite a long time. And whenever I see a client, I'm only interested in getting the sperm to the egg, no matter what it takes or how it's done. And I think, when you first start and you turn on that switch to have a baby, you're quite excited about things. Sex is great, everything's good, you're just waiting to see what's going to happen. But given sort of like 6 months, a year down the line, it becomes more complicated. And there are choices and paths that you have to take in order to sort of reach your destination. And so that's what I want to sort of talk about tonight, about what choices are available to you and what you need to do to be able to move on. Okay. I think you all know about me. I've been a midwife for 40 years. I've written books. I've had a clinic in London. I've got a range of products. But for me, my main thing, although the medical side is important, is looking at the holistic side and the mindset, which I think are key. So, looking at challenges that you all face, and I know the challenges you all face. Very often it's, I'm 34 going on to 35, my eggs are going to fall off a cliff. You change. Fertility does take a lot away from you when you've had a long journey trying to get there, of miscarriages or it not working. So, you do lose your creativity. You do lose the person you were before you started on this journey. It's harder to make decisions. And I often say that women are very, very intuitive. But when it comes to fertility, you lose that intuition because you're so desperate. And your life is ruled by gadgets and gizmos and apps, losing connection, not just with yourself, but every social event you go to becomes an obstacle. And you do get stuck in a negative mindset. And you don't feel like you've got control. But what I want you to take away from tonight is that what you do have control over is your thoughts, your emotions, your diet, nutrition. These are all things that you can control. But what makes it harder is dealing with uncertainty. So for many of you, you distance yourself from everything around you. And, you can feel quite low and quite depressed as a result. So where you are now, this is my little first questionnaire. And if you could just take a few minutes just to write down, what is your where you are now. I don't need to know that, but what is your biggest challenge right now? What is the biggest barrier that you have about where you're at? And just write something down now. And we all have a weak area, no matter where we are. So what do you need to focus on for the next sort of like month? It doesn't have to be everything at one go. Just write one thing down that you're weak in or you need to change and that you need to focus on. And, how will you make that change? What are you going to do? So, for example, Angela here has talked about being 34 years old, an AMH of 0.03, 3 follicles, an ultrasound and no follicles. So that is a really sort of like devastating result to get. So for someone like Angela, looking at where you are right now, you've had a negative result. What's your biggest challenge? Is what is the next step? What are you going to do? What are your options? What you're going to focus on for the next 30 days is strategy and working out what you need to do. And what you need to change. I know nothing about your life, but these are the things that you need to be realistic about. So just looking at the journey, it's so hard, isn't it? Because, you know, in this country, you wait this mythical year to get pregnant. You then go along to your GP. Your GP has 10 minutes, might be amazing, but 10 minutes to spend with you. And then, you know, it's either go away and relax or don't worry, everything's okay. And the thing is, you can't relax when you're trying for a baby, no matter what. During your fertile years, no matter what you've been through, you're always searching for the answers. So you can see here, you know, you start off, you go down this path. Very often you'll hit a dead end. You know, hindsight is absolutely amazing, but you get to the stage where you then have to sort of try naturally, and then you go through IVF, it doesn't work, then you go on to round 2, and you can see how time is really, really important here. And there's 2 questions I always ask and I'm always interested in. One is your age, and the second is time trying. Because, you know, again, the delays in the fertility, women don't understand when they first start out. So I very often get asked is, you know, I want to do an egg reserve test because I want to know how long I've got. Nobody can tell how long you've got. Nobody can tell you what your journey is going to be like. And you learn a lot in hindsight in terms of the steps you needed to take. So I do want to focus on this tonight. I'm going to answer the question that this lady's left at the end. So this is you know, an example of a fertility journey, and about how important it is to be strategic and make choices about what you're doing. So you can see for this lady, you know, start off, you stop taking the pill, then you have 5 rounds of Clomid that are unsuccessful, diagnosed with PCOS. Then you go on to do IVF, positive pregnancy test, healthy baby, which is brilliant, and you set up to start again. And so the time passes. So what I'm trying to show you here is there's no perfect time to have a baby, but if you want more than one child, you've got to sort of start earlier if you can, and you've got to start looking at what is going to give you the best options of success on that journey. So what are your options? There are many options, and I talk a lot about age, and I talk a lot about time trying. So, you know, you've spent 12 months trying to get pregnant, it hasn't actually happened. So then you look at what the options are. So the reason I'm talking about your options in terms of age is because you've got to start thinking, if you're 38, 39, some of these options at the beginning, like ovulation inductions, stimulated cycles, intrauterine insemination, you might need to go straight to IVF, which would give you a better success rate than trying all these things first, which is going to lose you valuable fertility time. So that's what I'm trying to get across here tonight. So then you've got IVF, you've got ICSI, you've got frozen embryo, eventually either egg donation or sperm donation. And, you know, there are many options available for women today that weren't available 20 years ago when I was doing a lot of this work. Then you either had a baby or you didn't. But now there are so many things you can do, and it's easy to get locked into 10 years of trying, which, you know, again, is really tough. So, you know, what is your strategy? And I'm always amazed with women that it's very hard to become interested in getting pregnant until you're actually ready to try. And then it's pretty full on. But women are strategic about their careers, their exercise, their diet, but very often the strategy for getting pregnant is over here somewhere. So you've got to think about your age. You've got to think about where you're at now and how many cycles you've had, if you have. Male factor, men are just as important as women when it comes to fertility. It's 50-50 now. How long you've been trying for. And when I say trying, I mean really trying. You know, having sex at least 3 times a week. Lots of people have issues around sex. They can't manage to have sex, or there's performance anxiety. So there are things that you can do. And very often you feel embarrassed to ask your doctor some of these questions. And then there's miscarriages, or any any known issues. So for example, if you're watching this and your mother had an early menopause, then it's important that you start as soon as you can, because the chances are that it is repeated with you. There may be a genetic link. So, what's the first option? The first option for me will be if a young woman comes along, her cycles are irregular, she's got PCOS, or she's just come off the pill and her cycles aren't returning. Apart from having the blood tests and the investigations and the check of your tubes, etc., there is something called ovulation induction. So what this does is you have a monitor cycle where you have blood tests done, you're scanned on a weekly basis, and then you're giving a drug such as Clomid to help you ovulate. And again, this is important. It can help many, many women get pregnant. But the reasons that you wouldn't have this would be if you've got a really low egg reserve, if you've got cysts on your ovaries, if there's any other underlying factors that may come in to fruition through talking to your doctor, etc. But it is a first line of treatment if you're not getting pregnant. So well worth considering. But again, it's age and time trying and looking at what the success rate here is. The next thing I get asked a lot is, should we do IVF for IUI? And again, it's down to age and success rates. IUI on its own isn't hugely successful. IUI and a stimulated cycle will work better for some women. But if you're 38, you don't want to waste time doing some of these treatments before, unless, because IVF may be more successful for you. And for some women, they worry that they feel disappointed they've got to that route. But it's about not wasting valuable fertility time and focusing on what is going to give you the best success rate for your age. So I'm assuming everybody watching this knows exactly what IUI and IVF are. So IUI is insemination, and it's putting through a catheter, putting the sperm up into the cervix. IVF is where you are stimulated, you have scans, you're on a protocol, and the eggs and the sperm are put together for like a natural fertilization. There are different protocols and different treatments that are used, and different clinics do different things. So for me, preparation is absolutely key. At least 4 to 6 weeks if you can. And that is looking at the whole holistic approach as well. And each clinic has its own different way of working. I would never take anybody out of the NHS. The NHS is really good, but it's a standard treatment. Some of the private clinics you go to, they're looking at a lot more treatments that you can have that may enhance your chances of getting pregnant. The most important thing is looking at a clinic and looking at the success rate that clinic has. Increasingly, more and more common is frozen embryo transfer. And this is when you've had your IVF cycle and sometimes you've got a lot of eggs and you've overstimulated. And that means that your eggs aren't put back on a fresh cycle. You wait to have them put back on a frozen cycle. So the embryos are frozen, they're put back, which gives your body time to recover and be put back in for transfer. Also, many clinics do this now for reasons of different hormones being at different levels. They'd rather wait a couple of cycles before the embryos are put back. And the success rate is very, very good. And increasingly, this is happening more and more. So for me, the key considerations areas are, and when I've been doing this for a long time now, and when I used to talk about lifestyle and nutrition and acupuncture and hypnotherapy and reflexology, I think I was considered, slightly mad. But now everybody is doing this. You know, this is more and more common, that you look at absolutely every aspect of what's going on in your life, quite rightly. And one of the things I've sort of really learned over the years is mindset is absolutely key. And when you look into the mind of a woman that's trying for a baby or going through IVF and dealing with uncertainty, it's really difficult. But for me, you can't achieve anything if your mindset's not right. You can't feel motivated, you can't exercise, you can't do the diet, you can't do anything. So for me, mindset is absolutely key. And there are a lot of things you can do to help your mindset through strategy, through stress reduction, through breathing, meditation, yoga, whatever it takes, is important to do this. Looking at your egg reserves and your hormones, looking at your lifestyle, your nutrition, and your stress, all come into fruition. So let's look at your emotional health for a minute. So, you know, the little wheel you have in front of you. And, you know, just marking this with 10 being the highest and 0 being the best you can be. And these emotions are really strong emotions. And in Chinese medicine, they cause stagnation in the body. In Western medicine, you know, when you have got powerful emotions such as grief and jealousy and anger and worry, it does set off a stress response in the body. It does raise cortisol, and it does cause stress, and stress is really, really damaging. So just spend a minute just going around here and working out for you what area of your emotional health that you need to focus on. I'll just give you a second to do this. And, you know, just sit with this and be really honest with yourself about what the predominant emotion is that you're feeling. And I know that you feel all of these emotions every day, but for most of us, we do have a predominant emotion that we express. That could be worry, it can be anger, it can be, you know, disconnect. Right, I'm lost a bit here at the moment. All right, I'm back again. Okay, so looking at your mindset. Mindset is really, really key to me. The conscious and the subconscious is what I do a lot of work when I'm coaching. And for so many women, they feed you can see here, there's a subconscious which is below the watermark and the conscious that's above. But the subconscious sort of are the stories we constantly tell ourselves and what our beliefs are. So, you know, if you've been told you've got a low AMH, it's like, well, my eggs are no good. It's not going to work for me. It's not going to happen. I'm not good enough. You know, the past and the present, we all enter fertility with our own unique set of baggage from what's happened in our past or where we've been. And what I try and encourage women to do is have a new approach to your challenges, a new way of thinking. And that's through visualizations and breathing, and through your nervous system as well, which I'll talk more about. But for me, fertility is a whole body event. It's not just something that happens in the fallopian tubes. Your thoughts, your emotions, your diet, your nutrients, your gut, your heart, your energy levels all come into play. And I do a lot of work within this area with neuroscience and using ancient Chinese medicine as well. And what's hard for today's women is that you look on the outside for all of the answers. You're surrounded by gadgets and gizmos telling you absolutely everything, a magnitude of information. But sometimes you need to step outside and just listen to your body and start a conversation with your body. And for me, looking at something like this, the brain, the heart, the gut, the uterus, give you some of those answers through neuroscience, understanding that we've got more than one intelligence in our body other than the brain. You know, the heart has a brain. It's capable of love, giving and receiving love. And when you disconnect from your heart, you disconnect from everything that's around you. The gut is all about courage and making decisions and letting go on many levels. And the womb is all about creativity and co-creation. And when I see many women, it does change you. Fertility does change you, whether you like it or not. And you don't become as creative. Your life is on hold. You don't open up to everybody. You don't have fun. And this is something that when I work with, I try and do visualizations to help women change the way they're thinking, because again, you do have control over your thoughts and your emotions. So, I mentioned briefly, the brain is about logistics and making meaning. And you can send messages to all your vital organs via the autonomic nervous system. The brain produces neurons that you can change. We know now through science and neuroscience that if you're constantly feeding yourself these negative messages, you'll strengthen those negative pathways. But if you're constantly repeating the positives, you'll strengthen the positive pathways, and the negative ones will reduce. The same with the heart. The heart's got connections and neurons. It releases oxytocin, which is the love hormone. But when you talk about the cognitive language, when I'm speaking to women and I ask about their hearts, they talk about their heart being heartbroken, heartache, heart of stone, etc. So again, opening up your heart through visualizations, through breathing, through thinking about somebody you love, will release that lovely hormone oxytocin, which is about bonding. The womb, when I ask somebody to describe their womb, somebody with endometriosis might say it just feels gnarled, it just doesn't feel fertile, it looks grey. So again, it's bringing out that creativity in what you used to do. It's really, really important. And the gut, we now know the brain and the gut connection, so much evidence and science on that. And the gut microbiome, and each organ has its own microbiome. So we know with the gut, it's not just about processing food. It produces serotonin, which is the happy hormone. And if the microbiome isn't right and you're taking lots of antibiotics, processed food, etc., it's going to affect your fertility. It's going to affect the hormones that you're able to make. So increasingly becoming more and more important. I've talked about the solution, resilience, building your resilience when you're going through this is key. Visualization, stress reduction, therapies such as hypnotherapy, acupuncture, counseling, anything that's going to help you feel better is really, really important. Evidence or no evidence. Some of the visualizations I do, they are on my Hug site, which you can go and have a look at. But again, they just guide you. They guided visualizations that help you connect to your heart. There's a sequence that I use when you're lying, listening, that connects you to all the different points. There's one for IVF, early pregnancy, etc. I'll let you look for yourself. So looking at diet, lifestyle and nutrition, there is so much information out there now. I'm amazed sometimes when I'm on Instagram to see that everybody is an expert, everybody is offering advice about diet, nutrition, etc. I try and keep it very, very simple, very, very simple. There's so much research done now on the Mediterranean diet, which can help, oils, fresh vegetables, eat in season. But also there's a lot of information about supplements, managing stress and expectations. So just taking a minute to look at your diet and, just focusing on how much meat do you eat? What proteins do you have? Too much red meat can cause inflammation in the body. How many fruit and veg do you have in a day? What are the carbohydrates that you're eating? And again, if you've got certain underlying conditions, inflammatory, immune, PCOS, you need to be reducing your carbohydrates. How many portions of fish do you have? How many units of alcohol do you have? Caffeinated drinks, so Coca-Cola, fizzy drinks, etc. Processed food, how much water do you drink in a day? Water is really important. It's really important for hydration. And what are the changes you need to make in your diet? This is very basic, but there's so much information that you can read out there. I've got a number of books that are really good books. There's the IVF diet book and there's Eat Yourself Pregnant. There's so much information in there that I can't, give you this evening. So now looking at your lifestyle. Lifestyle isn't just about what you eat and drink. Lifestyle is about your whole life. So it's about your relationships, your work-life balance, how you're sleeping, what exercise you're having, what's your sex life like, what's your, how much fun do you have, how much energy you have, how stressed you are. And so take a minute as well to look at this and where are the key points that you need to work on? Is it your sleep? Is it your relationship? Is it your energy levels? Is it your sex life? Is it having a bit more fun? Life not being on hold? Just sort of fill this in and see what it comes up to for you. One of the things that women often forget is that you need to look as well. I'm often asked, well, why do I need to take a supplement if I've got a balanced diet? Balanced diets don't exist. I think for most women, they're ruled by their moods, their foods, and their hormones. And, good some weeks, bad the others. But nutrients are depleted from your body if you've got a poor lifestyle, if you over-exercise, if you're stressed, if you have lack of sleep, if you're on medication, environmental, and also, chemical exposures as well. And again, if your gut, you've got IBS or diarrhea or constipation, it means that your gut's not able to absorb the nutrients it needs to absorb. And you need those nutrients to be able to make hormones and to make eggs. So important that you look at your lifestyle. Oh, that's nice that somebody's written a really nice thing. Thank you, Evie. I've just read that. So again, when we look at trying to conceive, you're looking at not just getting a healthy egg, but a mature egg. And an egg goes through a life cycle. We all have cycles and clocks that go on in our body. And it takes about 150 days for an egg to mature. And, when you think about that egg, it needs your gut to be able to absorb the nutrients well. It goes through lots of different phases. You've got the follicular phase, you've got the ovulation phase, and you've got the luteal phase. And when you look at what an egg and a sperm need, can you move the egg on? Yeah. Egg and a sperm need. It needs energy. It needs so much energy. And so when you look at this egg cell, it has it needs antioxidants to protect the outside of the egg. The cell membrane needs omega-3. The mitochondria of the egg is 550 times bigger than the sperm, and it needs energy, lots and lots of energy. And the nucleus of the egg is where the genetics are, which is really important. And so for the sperm, the most important job a sperm has is to deliver what I call the crown jewels, which is the genetic material into the egg. So what an egg needs is the same as a sperm needs. But when you're doing something like IVF, you want to produce a lot of eggs. So the cell membranes, omega-3, the mitochondria, ubiquinol, coenzyme Q10, the nucleus, folate, really, really important. But, don't underestimate as well the fluid that surrounds the egg. The follicular fluid is rich in vitamin D and it's rich in inositol. So you want to be doing everything you can to make a mature egg that will go on to fertilize, make an embryo, a pregnancy, etc. So the sperm is the same. I mean, men are very fortunate. They're producing sperm 24/7. And it takes about 100 days to mature a sperm. So again, it's exactly the same. It needs protection from free radicals, the DNA around the head of the sperm for the cell membrane, DHA, the mitochondria, coenzyme Q10 to give it energy to be able to swim. So, the same, but in different quantities. So here's showing you what an egg needs. The vitamin D, coenzyme Q10, inositol, antioxidants, omega-3, etc. And it's the same for the sperm. Just trying to show you here what a sperm needs, exactly the same as what an egg needs. Okay, so obviously, you know, we do a lot of supplements for egg and sperm health. And, you know, what I'm very much involved in the supplements, in the formulations. It's been my life for the last 20 years, which, you know, I really enjoy. I love doing the research and looking at what's going to help. So the nutrients have to be the right nutrients, which means they're bioavailable, they're easily absorbed in the body, and they're clinically studied. The quality of the ingredients is really important. Our products are made in the UK and we can trace all the raw ingredients, and that we're looking at therapeutic dosages. So we do lots and lots of ranges for different stages of pregnancy. And what we've tried to do is include all the nutrients that you're needed at different stages. So we've got the IVF support pack, we've got the male fertility pack, we've got the frozen embryo pack. Those that of you are thinking about freezing your eggs, we've got a frozen egg pack as well. So it's taking the right things at the right time. So as we're moving on now, looking at your chart again and working out from the first emotional health one you did, what are you going to change? Which of these key elements, which of these key emotions are bothering you the most? And what do you need to let go of here? What do you need to sort of change in the way you're thinking, the way you're feeling, and what of each of these circles represent for you? So preparing for fertility, these are the key things that I think are really, really important. Is, you know, everything we do in our life, every major event that we ever have as an adult, we prepare for. So a wedding, you don't buy your wedding dress on a Friday to get married on Saturday. You know, if you are having a party, you plan and you prepare the caterers, the music, the disco, whatever. If you are doing a christening, it's the same. Every sort of thing. If you're running the marathon or have just run the marathon, it's not something you just get out of bed on a Saturday or Sunday and do a marathon. You spend months preparing for it. So for me, the key things are mindset preparation. I don't believe you can do anything if your mindset isn't in the right place. And one or two of the questions that come through here are, you know, my AMH is 3.9, I'm doing IVF, I've just decided it's not going to work for me. That is the wrong mindset to have. It's sort of so fixed, it's inflexible. You've got to look at the positives no matter what you're doing. Egg and sperm health are key. Building up your energy reserves. I don't think there's one woman I've ever asked what her energy is like. She's come back and said, oh my God, it's abundant. It's not, because, you know, when you're going through this, your reserves are low. You're probably not sleeping. You're waking up at 3 or 4 in the morning worrying. You're working too hard. The way to build up your reserves are through sleep, through going out in nature, listening to music or bird song. And there was a recent research about this. And that is the way you build up your reserves. Staying away from your computer or your phone, not bringing it to bed with you, just doing little things that are going to make changes. So, you know, you're not going to bed bombarded. You're not reading an email or an Instagram that has wound you up. Getting through the hurdles are really important, but for that you need to prepare, because anybody who goes through IVF will know that to get to the other end to transfer is huge. So understanding what the hurdles are and how you're going to manage, and that comes back to mindset. You know, when you go to a clinic that's late, most IVF clinics run late, that your cortisol isn't searing through the ceiling because you've got to be back at work. Learn to breathe, learn to prepare. I obviously advocate to prepare 4 to 6 weeks prior to IVF. And there's things like acupuncture you can have, look at nutrition, breathing, yoga, etc. 3 months is better. But again, I'm a realist. I think that it's easier to prepare in 4 to 6 weeks stance. Again, taking the vitamins beforehand is great, but some of the treatments you're doing, build up to it and work out what you need to be doing. So think now, from what I've said, where you are now, looking what supplements you're on. There's so much information on our website that's going to help you. Under 35, are there any known issues, your thyroid, etc.? If you're over 35, where are you now? What do you need to do? Are you looking at ovulation induction or IVF or FET? Secondary fertility issues come up a lot. And for so many women, once they got pregnant the first time, didn't think about it. When it comes to try and get pregnant the second time, so much information comes up as a result. And it doesn't happen as quickly as you think it is. Are there any underlying issues such as polycystic ovaries, endometriosis, inflammation, etc.? So choose the supplements, lots of information. There's a quiz on our website that are going to suit you for where you are now. So stay up to date with us. We have a lot of information. We do live Instagrams. Rebecca, who's our nutritionist, does a lot of free 15-minute consultations with you, and again can guide you about what supplements to take. I am back practicing, so I am seeing clients. I do 2 sorts of consultations, one which is a one-to-one, which is 2 hours, and that looks at where you are medically and what the next steps are. And the second part of that 2 hours is looking at your mindset and helping you transform and make those changes. The second consultation I do is by Zoom, and it's 1 hour, and it's working out where to go, what to do, which clinics, etc., and which therapists are going to be able to help you. And I'm going to be setting up something called the Zita West Collective quite soon, so please follow on Hug for that. And these are the books I was talking about earlier, which I'm very proud of. They're really brilliant books. And especially the IVF diet one and Eat Yourself Pregnant, they go through a lot more in detail than what I've done here this evening. So thank you all for joining me. And I'm going to move on to Q&As now here. So let me just go back to the beginning of the questions. Okay. Hi, Zita. Any thoughts on progesterone blood checking when doing IVF? Yes, I do. Certainly, when I had the clinic, we used to check we used to do a lot of checks on progesterone, and we used to do it when you were going through a cycle, just to determine what the levels were. And very often, if your progesterone was too high, our doctors wouldn't transfer the embryos. They'd wait till it came down and do a frozen embryo transfer. Will we have access to this recording? Yes. 34 years old. My AMH is 0.03. In January, I had 3 follicles. Yesterday, I had an ultrasound and no follicles. Well, this is devastating, Angela. And what you need to do is retest and talk to your doctors about what needs to happen, because things can change from month to month, but the AMH is very, very low. So you're still young, but it may involve looking at different options as well. What are your thoughts on the validity of the Chicago blood tests, impact of elevated NK cells? My IVF clinic don't believe in them, and the link to fertility. This is a difficult one because it's quite specialist, and we used to do a lot of this work with Dr. George Ndukwe. And I think if you've got, not everybody needs to have their Chicago blood test or their NK cells checked, but if you're having lots of failed cycles and you've got immune issues, I think there's a valid reason to try to have these tests, but at a clinic that specializes in this. I'm on my first cycle of Clomid, but my period's still not arrived. Cycle day 31. I am 38, bloods all seem normal at the moment, been trying for 2 years in June, only seen one doctor in February with the weight. Would I just wait for the next cycle to start again or take another certain day? I think this is difficult. There's a couple of things here. You know, you are 38, so you are older. You've been trying for 2 years now and nothing's happened. You're on your first cycle of Clomid, which I hope works for you, but you should really be considering where you're going to get the best chance of success. I don't know anything about your AMH, etc., but that might be possibly IVF if you have a couple of IUIs or Clomid cycles and then move on to see what's going to happen. You mentioned clinic success rates. What are the criteria that are measured here and what is considered as a good score? There is a website, the HFEA website, which gives you all the success rates for clinics up and down the country. So that's the one to go on and look and see what the best success rates are. Obviously, the higher the success rate, the better. So go and look on the HFEA website and see what it's got to, what it can show you about the clinic that you're at. I'm a 5-element acupuncture, and I'm so happy you have focus on emotional impact on fertility and over well-being. Yeah, 5-element acupuncture is brilliant. And acupuncture supports so many women when they're going through. We started our IVF journey in December. We've had 2 back-to-back cycles. Can't pronounce that. That was abandoned, and my ovaries were not responding. We have had a 3rd cycle of duostim with Mario FET, which worked out. We had got 1 egg fertilized and frozen. So choose to do 1 more cycle. Our 4th attempt, again, we use Mario FET, but this time it did not work as my ovaries again have not stimulated. The cycle was abandoned. The doctor said to give the ovaries a little break. How long should we wait, in your opinion? I think you've got to be guided here by what your doctors are saying to you, because I don't have the full medical history. So I think whatever your doctors say, I would go along with. What's the next one? We are going through a natural FET cycle. What is your opinion on this type of FET? Well, I think it's good. I mean, if you're going through a natural FET cycle, the good thing about this is that your body is calmed down, your ovaries are calmed down. So it's good to put the embryos back because your body is not going to be have as many drugs as it did when you were going through IVF. Hi, Zita. Thank you. I am doing my 2nd IUI tomorrow morning. Do you have any tips for the day of procedure or the 2-week wait? Last time we were on progesterone suppositories and baby blood thinners. Age 34, husband is 42. If this fails, we will do an FET, try to reduce alcohol, etc. So you can't really do an FET with an IUI, so I'm presuming that you're moving on. So tomorrow, I mean, the biggest thing I see when women are doing IUIs or egg transfers, it's quite a stressful day. So make sure you are organized and you've got everything ready to go out the door. You don't lose your keys or whatever, because that sometimes happens. You're so distracted. I really believe in resting when you've done anything like IUI or IVF. I don't think it does you any harm because it is quite a stressful procedure and you are obviously very often very tired. What is your opinion on inofolate? We do something called inositol, which is folate and instead of folic acid, and inositol. So it's really, really helpful. I use it a lot for older women. It helps with maturing the eggs. It's really good for polycystic ovaries or if your cycles are irregular. So I'm a great fan, but it's got to be myo-inositol. That is the one that has had the studies done on it. What's your view on frozen embryo transfer? Is it safe to transfer 2 embryos? My view on frozen embryo transfer is it's very good. It has a very, very good success rate. As regard transferring 2 embryos, that's purely down to your doctors and the embryologists. Usually we encourage one embryo to be transferred, but it depends on what those embryos are like, because there's a risk of twins and there's a risk of triplets if another egg divides. So you need to be guided by your doctor. Hi Zita, I'm 42, have mild Crohn's disease and have fallen pregnant 3 times naturally in the last 2 years, which have all resulted in early miscarriages. I'm now doing all the tests for recurrent miscarriage and looking into IVF. Do you think that Crohn's disease may be a cause of miscarriage? It depends on the severity, but again, Crohn's disease is an inflammatory condition, and you can have flare-ups, and sometimes you're put on steroids for this. So I think nutritionally and nutrient-wise, it's really important for vitamin D. It's really important to take omega-3 essential fats. And sometimes it can have a link to immune. So there may be, if you're doing these miscarriages, obviously you are getting pregnant, I think it's worth looking at some of the immune bloods as well. And this is sometimes difficult because not all clinics believe in this, but if you can find someone somewhere that does this, I think it's important to talk to your doctors. What is the evidence on acupuncture and IVF success? It's an interesting question. I mean, there is a lot of evidence to support the use of acupuncture. We now know that acupuncture can help with pelvic blood flow to the ovaries. If you've got a good blood flow, you've got lots of nutrients passing. There have been studies and meta-analysis done on IVF success rate and acupuncture. The jury's sometimes out on this. I do believe, though, acupuncture helps with endorphin release. Many acupuncturists are trained in fertility, so they're able to help you and support you going through the process. And I think it's well worth doing. And as an acupuncturist, of course, I would say that. But I think that many women do have IVF before and after transfer. So I think it is worth doing if you can. Do you have any top tips on creating stronger sperm? Yeah, I do. I think that eggs and sperm, although they need the same nutrients, I think there are many factors that can help. So, you know, arginine, NAC, vitamin D, omega-3, coenzyme Q10, all of these are good for sperm health. Okay. I have had 5 cycles of ICSI since September 21, and our last resulted in 1 egg failed to fertilize. I have an AMH of 13, and I feel like I'm being pushed towards donor eggs. Is there anything I can do to improve my eggs? I take all your supplements. I don't drink. I exercise. I have fertility yoga and a microprolactinemia. I guess it's just to know. I don't know how old you are, Sarah. And I don't know, like an AMH of 13 is really good. I would be reluctant to go down a donor egg route with that AMH. I don't know how much focus is done on your partner with ICSI, whether he's had DNA fragmentation, etc., and whether he's on supplements or not. So, you know, I hope this helps, but without a medical background, it's quite difficult. Are your visualizations suitable for single women having treatment? Or do the scripts include mention of partners? So much fertility assumes that people are straight. No, my visualizations are just for women, not for the partners. And you're quite right. Some of the things I've been talking about tonight, I've talked about partners, etc. And again, for many same-sex couples, they don't have fertility issues. They just need the sperm. So having talked about IUI and stimulated ovulation not being that successful, it certainly is successful for same-sex couples. So yes, the visualizations are very much focused on women and not partners. Thank you. I'm 38 and I've had an AMH of 8. Partner is 43. Good sperm count but low motility. We don't know how to best process. Any advice recommend that you would have? I just think the fact that you're 38, your AMH is not bad. I just think you need to sort of look at doing something like IVF or ICSI sooner rather than later. Because it's going to give you the best chance. And I don't want you to look back and have any regrets. We're about to start IUI in a month's time. What supplements would you recommend? My partner female is already taking a higher level of folic acid. I'm not keen on folic acid 5 milligrams. That's quite high, which indicates that your partner may have a blood disorder called MTHFR. Folate is better than folic acid. It's more natural, it's more readily absorbed by the body. And if you have got MTHFR, folate isn't good to be taking, because it's harder for you to metabolize. So the supplements I would take, I would look at inositol, I would look at DHA, I would look at coenzyme Q10, vitamin D, all of those, which is part of our pack. So go back and have a look on all of those. Hi Zita, what are your thoughts on DHEA for patients with diminished ovarian reserve? I think DHEA can be beneficial. It depends, I think, on your age, and you need to have a blood test to check for free testosterone. The hard thing about DHEA, it can convert to estrogen or testosterone in the body. And if you're younger and it converts to testosterone, that can be quite damaging for your eggs. But anything's worth a try, especially if you're older. What is the best to begin acupuncture prior to frozen embryo transfer? One of the slides suggested 25 minutes prior to ET. No, I think that with egg transfer, what we certainly did at the clinic is it was on the day of. It's very hard. It's an extra impossible unless you're doing studies. And this was the research that's done, to have it 25 minutes prior to ET. So we do it on the day and after transfer as well. With a 4 to 6 week prep, I'm 44 in August and have good numbers, single, wishing to go through IVF, no underlying issues, healthy lifestyle, or is it best to get going sooner? I think it's really hard. Being 44, it's difficult to get pregnant and for IVF to work. But if your AMH is good and you've got good numbers, there are certain things that doctors can do now to be able to screen and test the eggs. So I think that you need to look at that. Do eggs get, what does that mean? Your younger eggs, I mean, do your eggs get Trump prep time? I don't understand the question. Okay, if you could recommend one thing to help us with implantation naturally, what would you recommend? It's hard for me to recommend one thing, but I do think the microbiome now is increasingly important. So I would take Femsieve and Mensieve, because the studies on that have shown that it can increase implantation around IVF for the female microbiome, but also the microbiome of the sperm. So definitely well worth taking. Hi Zita, partner has a low sperm count. Is there anything you would do to help to improve this? Yeah, I think there are many supplements that you can take to help to improve it, but looking at his diet and his lifestyle as well, making sure no jacuzzis or hot baths. But, you know, on our website, there's a lot of information about sperm. 19 eggs, but only 2 fertilized and neither suitable for transfer. Doctor mentioned that it might have been due to high prolactin level, but this wasn't checked in time. Oh, right. Okay. Yeah, prolactin it's great that you've got 19 eggs. It's such a shame that only 2 fertilized. It may be due to prolactin if it's very, very high. But, talk to your doctors about what the next steps are, because this, it's great that you've got those eggs. It's just trying to get them fertilized. Does supplementation assist with follicular count growth when going through an IVF cycle? It depends, everybody is different, and supplementation works better in some women than others, but it's worth ticking that box to show that you've tried. Do you recommend IVF supporting products for my acupuncture fertility patients? Yes, I do. And I think the kits we use, and certainly Rebecca can do more information for acupuncturists and therapists on what nutrients work and when. This is my last question now. My husband and Mariah are about to start IVF, but the clinic found a 5 centimeter endometrioma on my left ovary. Good egg count, slightly low AMH overall, 33 years old. My clinic have advised surgery, removing the cyst before.
Oh, yeah.
Would you say What
Yeah,
are
I'm trying to do the implantation thing there, 'cause that's what's now.
Yeah, so go.
Oh, yours is so bad. It's the here on the Wi-Fi. Being
It's fine.
okay? I've just
Just turn yours on.
I think it's important that you have the endometrioma removed. You've got a good egg count, so that is really excellent. You're only 33, so all of these things can make a difference to you, definitely. Right, I've come to the end of the session. I hope you all got something from it. Please follow us. There's a lot of things we do each month, IGTVs, etc. We have offers on different supplements. My visualizations are on Hug, so go on to there as well. But it's been a pleasure to be with you all, and I hope you've enjoyed this webinar.